Today we'll be performing a general anaesthetic procedure on Kia, one of the cheetah here at the zoo. The keepers noticed that she became acutely uncomfortable when she was eating and was doing a lot of flicking of her tongue and eating on one side of the mouth. Kia actually had a fracture of her upper right canine tooth, which is the largest tooth in the mouth, which occurred in 2020, and she had a procedure at the time to do a root canal to fill that tooth, and it has been absolutely fine since then. But what we want to check today is just that there aren't any complications happening with that tooth or any of the other teeth in her mouth. We're very lucky to have a relationship with a veterinary dental specialist, and he's come in to help us with more complicated dental procedures. So the first part of the procedure today is really that Russell's going to have a good look around the mouth and see if he can find a reason for this abnormal behaviour.
It's actually reabsorbing the tooth.
What Russell was able to see is that the tooth was actually resorbing, so being laid down with bone and resorbed into the gum. Now normally that process would then be followed by the tooth just snapping off in the mouth, and it seems that that might be the cause of the pain in Kia's case, and so based on that, removing the tooth is going to be a better option for her to keep her pain-free long term. So there's a lot of different parts of the team who are all involved to bring this together and make it go smoothly. Russell was able to get the tooth out in one piece, which is fantastic, and there was no evidence of any infection associated with that as well. Kia's obviously going to be uncomfortable where that tooth has been removed, so we will keep her on some pain relief for at least a week. The main thing now is that the keepers just monitor her closely, that the pain associated with that tooth has resolved and that she's eating normally on both sides of her mouth again.